Jane was the heart of her family, a woman full of life and laughter. But then, something changed. What started as simple forgetfulness soon revealed a much darker reality. Jane's family noticed the changes and couldn't help but worry. Was it just aging or something more? Vascular dementia, a condition that robs you of your memories, your abilities, your very self. Dementia is a broad category of brain diseases that cause a long-term and often gradual decrease in the ability to think and remember. This decline in cognitive skills can severely impact a person's daily life. Vascular dementia is the second most common type of dementia after Alzheimer's disease, accounting for approximately 10 to 20% of dementia cases. Jane was diagnosed with multi-infarct dementia, a type of vascular dementia caused by multiple small strokes occurring in different parts of the brain. Each stroke damages brain tissue, leading to a stepwise decline in cognitive abilities. Symptoms can appear suddenly and worsen in steps after each stroke. Common signs include confusion, disorientation, trouble speaking or understanding speech, and physical issues like weakness or paralysis. Jane's family noticed she often became disoriented, struggled to speak clearly, and had sudden episodes of weakness. Each small stroke took a bit more of her sharp wit and vibrant personality. While Jane's experience with multi-infarct dementia is unique, it's important to understand the other types of vascular dementia. Subcortical vascular dementia, also known as Binswanger's disease, affects the small blood vessels in the brain's white matter. This condition leads to symptoms such as slow thinking, difficulty walking, and urinary incontinence. Mood changes like depression or a lack of interest in activities are also common. Unlike Alzheimer's disease, memory loss is less prominent in the early stages. Single infarct dementia, on the other hand, occurs when a single stroke hits a critical area of the brain involved in cognition, such as the thalamus, hippocampus, or angular gyrus. The symptoms vary based on the stroke's location, but can include sudden memory loss, confusion, and difficulties with language, vision, or spatial skills. This type of dementia is caused by a single event rather than ongoing small vessel damage. Jane's journey, though deeply personal, mirrors the experiences of many others battling these different forms of vascular dementia. Jane's decline was not just a result of time, but several underlying factors that quietly worked against her. Her family began to piece together the silent enemies in her life. High blood pressure silently damaged blood vessels in Jane's brain. Diabetes and high cholesterol further narrowed and hardened them. Heart conditions led to clots that traveled to her brain. While smoking, genetics, and obesity are also significant risk factors for vascular dementia. In Jane's case, it was the combination of her medical conditions and aging that drove her decline. As Jane's condition progressed, her family noticed more troubling changes that signaled the decline of her cognitive abilities. It started with small things. Jane often forgot about recent events or conversations, misplaced her keys, and missed appointments. Planning and solving problems became increasingly difficult. She struggled to follow a recipe she had known by heart for years. Simple decisions, like choosing what to wear, became overwhelming tasks. Her family watched as she stood in front of her closet, lost in thought, unable to decide. Confusion and getting lost, even in familiar places, became more frequent. There were days when Jane didn't recognize her neighborhood or forgot the way to a nearby store. Mood swings and irritability set in, and depression took hold, sapping her joy and interest in activities she once loved. While these were just a few of the symptoms Jane experienced, people suffering vascular dementia may have other symptoms. Speaking and understanding speech can be particularly challenging. Finding the right words or mixing them up can make conversations, especially complex ones, hard to follow. Depending on the affected parts of the brain, physical symptoms can include weakness or numbness on one side of the body, trouble walking, or balance issues. Some might also face bladder control problems, leading to accidents. Slowed thinking makes it hard to process information or respond to questions. Tasks that used to be easy can now take much longer. In short, vascular dementia affects memory, problem-solving, orientation, language, physical abilities, mood, and thinking speed. Symptoms vary depending on the damaged brain parts and the severity of the condition. For Jane, each symptom was a heartbreaking step deeper into the world of vascular dementia. Her once vibrant personality slowly faded, replaced by confusion and disorientation. Desperate for answers, her family embarked on a quest to understand the mysterious changes overtaking their beloved Jane. They sought the expertise of doctors. Diagnosing vascular dementia involves several steps. Jane's journey through diagnosis began with her medical history. Frequent high blood pressure and a previous minor stroke highlighted her risks. Physical and neurological exams revealed weakness on one side and reduced reflexes, signs of stroke impacts. Cognitive tests confirmed difficulties with memory, problem-solving, and language skills. Brain imaging showed multiple small infarcts, tiny areas of dead tissue scattered throughout her brain. Blood tests indicated high cholesterol and poor blood sugar control, narrowing and hardening her blood vessels. Doctors might also check the heart and blood vessels. A carotid ultrasound, which is an ultrasound of the neck arteries, looks for blockages. An electrocardiogram, ECG, checks for heart problems like atrial fibrillation, which can lead to strokes. The tests painted a comprehensive and concerning picture. Jane's family now understood the full extent of her condition and the urgent need for treatment. Treating vascular dementia focuses on managing symptoms and preventing further brain damage. Jane's doctors outlined a comprehensive plan to help her. Medications were prescribed to control her blood pressure, cholesterol, and blood sugar. Jane's family rallied around her, encouraging her to adopt a healthy diet, exercise regularly, quit smoking, and limit alcohol. Cognitive therapy and memory aids were introduced to help Jane cope with daily challenges. Supportive care became essential for both Jane and her caregivers. Support groups provided emotional support and practical advice, offering a sense of community and understanding. Respite care gave her family much-needed breaks, while home modifications ensured Jane could live safely and comfortably. While there is no cure for vascular dementia, managing health conditions, making lifestyle changes, and engaging in cognitive therapy can help slow its progression and improve quality of life. CADASIL is a rare genetic form of vascular dementia caused by a faulty gene. If one parent carries this gene, their child has a 50% chance of inheriting it. Jane's family wanted to understand if genetics played a role in her condition. People with CADASIL often experience mild strokes, leading to symptoms like severe headaches, difficulty speaking, and weakness on one side of the body. About 2 in 3 people with CADASIL develop dementia, with symptoms like slow thinking, attention problems, and emotional changes. It was later proved that Jane did not have CADASIL. Jane's journey through vascular dementia revealed the profound care and support required in her final stages. Jane's family helped her with everyday tasks, bathing, dressing, and eating. As her condition worsened, they guided her through the house, managed her medications, and took her to medical appointments. They also engaged her in conversations and activities to keep her mind active. In her final days, Jane's health declined rapidly. She was bedridden and unable to move or speak clearly. Her memory faded, and she no longer recognized her loved ones. Yet, her family stayed close, providing comfort and love. Jane's death was due to complications from vascular dementia and multiple strokes. In her last moments, she was surrounded by her family,